Okay, hang in with us, because in fact we have something more serious to talk about at this point that we want people to know about. People hear a lot about HIV, the human immunodeficiency virus, and we're glad that people have some broad information about this virus. We want to make sure you have some key points. The virus is the thing that causes AIDS. Now, you can get a blood test for HIV. The problem with the blood test is you can't just have one, because there's a window period up to 13 weeks where you could, in fact, be infected, but the antibodies haven't shown yet in the blood system. So what you need to do is abstain or use safer sex through that period and then get a second test to make sure that you're safe.
A few common signs and symptoms of the infection of HIV are night sweats, swollen glands that last for about 2 months, severe killer diarrhea, severe weight loss, or a chronic cough that does not go away, or a yeast infection, systemic yeast infection that is resistant to treatment. For women, there will be gynecological signs and symptoms, including a severe yeast infection that resists all forms of treatment.
Since there is no cure or vaccine, prevention needs to be the focus, and we'll talk about that in just a minute. What we all need to do is to be empathetic, to understand, and to give our love to people who are infected with HIV.
And to know that you can hug them, and you can kiss them, and you can hold hands, and you can be with them, and you can share a cup of coffee, and know that you will not pick up the infection that way. It is spread by other forms of transmission.
Now, with all of these infections, there are things you can do to reduce your risk. I guess the most surefire way is no sexual intercourse, no penetration.
No, and then the other thing you can do is be in a strictly monogamous, long-term, loving, committed relationship where there are no outside partners at all, so that you know you have not been exposed.
If that's not your situation, then you need to practice safer sex. There's nothing that's 100% sure for either pregnancy or STDs, but there are things you can do to reduce the risk.
Talk to your partner. Check out what your partner's past has been. Find out if they have been involved in high-risk behavior, and then you will know, and you can be advised.
And use condoms.
Always.
Okay.
Practice safer sex.
This is called synchronized condom use. First, you have to make sure it's around. It's not out in the car, it's not down the hall. Make sure it's close at hand.
Yes. Make sure you've checked the package and checked the expiry date so that they're not out of date and useless.
Right.
Now, you take the package and you very gently tear it.
Do
not tear the condom by mistake. Do not poke your fingernail through the condom by mistake.
Don't grab it with your teeth. Now, make sure that the right end is up. If it's rolling down backwards, it's not going to go far. So make sure that you have it rolling down the right way. Take the air out of the end of it and slip it all the way down to the end of the penis. Penis needs to be erect at this point or this isn't going to work.
No, it's not. It's going to be very difficult rolling it on. Now, you leave a space at the tip. That's your safety valve right there. That's where the ejaculate is stored. And then you very gently squeeze that. Now that expels the air, so now you've got negative pressure in there, so that when a male ejaculates, there's room for the ejaculate to be stored.
At this point, if you're going to use a lubricant, make sure that it's a water-based lubricant. Do not use anything like Vaseline, anything that has oil in it, baby oil, anything else, because it eats through this latex.
And then, guys, before you withdraw penis from the vagina, guys, you must hold onto the condom. Otherwise, the condom is going to slip off, stay in the vagina, spill out all the ejaculate. She can get pregnant, she can get a disease, and he can get a sexually transmitted disease.
So make sure you talk to your partner about how you're going to practice safer sex. It may be that you're not going to have intercourse, penetration. There are lots and lots of other ways you can pleasure yourself that are safe.
And guys, when you go to buy condoms, you don't have to go into the drugstore and buy a package of super large. It's okay. One size fits all. You're covered.
So, thanks for hanging in.
We've given you a lot of information. It may sound like we're killing all your fun, but actually, if you know about sexually transmitted diseases, can talk about it, and practice safer sex, you'll probably enjoy sex more in the long run.
If you have more questions, contact your local public health, call a birth control or AIDS hotline in your area, and take care.
Thanks for watching. Bye-bye.